Hello guys, welcome back. Today our topic is what is coronavirus. So guys, let's start the topic. Number 1. What is coronavirus? Coronaviruses are a large family of viruses with 4 human viruses causing mild cold in all age groups. The virus look like it has a crown, hence the name. The family also includes viruses from animals that can infect humans in process called zoonosis. This form of infection has caused several phenomena and death, such as the new virus coronavirus COVID-19 in Wuhan and Hubei region of China. Previously, we have seen similar disease with the severe acute respiratory virus SARS and Middle East respiratory syndrome coronavirus SARS viruses. Number 2. How does coronavirus infect? The original new coronavirus infection probably came from an animal and infected humans. Now it infects people through sneezing and coughing, but also through contact with virus contaminated surface. Number 3. What are the symptoms? Common symptoms are respiratory symptoms with fever, fatigue, cough, and very rapid and labored breathing. Several symptoms may include pneumonia, severe acute respiratory syndrome, renal failure, and death. Point 4. What should you be aware of if you are afraid of getting infected? It is an acute infection with common cold symptoms. If you have been in contact with someone who may be infected, especially from the Wuhan or Hubei region, you should contact the healthcare system if you suspect infection, and especially if you have rapid or labored breathing. Many frontline healthcare workers have been infected. Number 5. What precautions should you take if you are traveling or going to one of the countries where the virus has been detected? Wash your hands frequently with soap and water or alcohol-based hand infection. Good coughing and nose hygiene is also important by covering your mouth and nose with paper towels and the elbow. Discard the handkerchief and wash your hand afterward. Avoid close contact with sick people with fever and respiratory symptoms. Avoid close contact with animals and markets that sell animal and fresh produce. It is important that meat and eggs are sufficiently cooked or fried, and follow good food hygiene. Number 6. Who dies of the new coronavirus? About 20% of the infections are serious and about 3% of cases have died in Hubei due to pneumonia, but mortality rates are lower in the rest of the world at 0.3%. Many patients who experience severe disease have diabetes, pulmonary disease, or other chronic disease. Half of those killed have had underlying illness. Number 7. What is the probability of the coronavirus being detected in Norway? So far, 28 countries have reported infection, and infected travelers may bring the virus to the Norway. About 80% of cases cause mild respiratory tract infection. The virus is only dangerous if it spreads easily between people in Norway. Number 8. What is the definition of a pandemic? A pandemic is a major worldwide epidemic where an infectious disease spread in several parts of the world. Number 9. What is the risk of the new coronavirus causing a pandemic? Neither SARS or nor MERS develop into pandemics, but we have seen the situation change rapidly with COVID-19, and the WHO has recently declared a so-called public health emergencies of international concern (PHEIC). This means that experts from around the world work together to identify outbreaks, share various knowledge, and inform each other about treatment for the outbreak to develop into a pandemic. It must be a virus that spread easily from person to person across all regions around the world. So far, the infections have been confirmed in several countries in Asia, the United States, and Europe. Number 10. Should you avoid traveling to the countries where the infection has been detected? There are no specific medicine or vaccine against the new coronavirus. Therefore, one should consider postponing travel to China and especially the Wuhan and Hubei region unless necessary. As the situation is changing rapidly, it is best to keep up to date with the World Health Organization (WHO) travel advice.